Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel you'll find several videos, what I like to call aha moments, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine or alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. In today's aha moment, I'm going to be discussing heartburn. Seen lots of it anyway prior to 2020, but especially now with 2020 and all the stresses that people have been under, heartburn's a big one. So we'll look at the causes not only from Western medicine, but also alternative schools of thought, and then look at the differences between that and all important and heart attack, very important. And then we'll also talk about some different types of treatments to see what you want to do. So stay tuned. So let's start looking at heartburn and possible causes from different schools of thought. First one, let's just take Western medicine. When Western medicine looks at causes of heartburn, what we know about the stomach, will go in a little bit of the pathophysiology of it, not much or I'll probably fall asleep. But basically with it, what happens is the stomach has some very, very, very important functions. And it all has to be in balance. Everything in our body usually has to be in balance. When it comes to things like the stomach, there are certain cells that have certain functions. So some of the cells in the stomach secrete what are called hydrochloric acid, and that's needed for us to digest our food. Very, very important. There are other cells that also secrete histamines, and sometimes histamines aren't a bad thing. They're in balance, and there's bacteria. Lots of people talk about gut flora and things like that. Well, there's bacteria like H. pylori and other things that are normal inhabitants of the stomach. However, if things get out of balance, then what can happen is it can overgrow. So what happens with that is those cells of the stomach produce that hydrochloric acid, which is wonderful. It helps digest our food. Well, there's also cells in the stomach that secrete, they're mucus secreting cells. We need that because the stomach is at a very, very low pH, which is very acidic. And we need that in order to break down our food. But what can cause heartburn? Well, many different issues from Western medicine. One of them, let's look at chemical issues or things that can destroy that lining of the stomach and cause extra problems with the hydrochloric acid. So what could that be? Well, alcohol, cigarettes, even chocolate in high doses, things like that, can break down that lining of the stomach. And when that happens, the mucus secreting cells are trying to protect, but they can't quite do that very well. So then also you can get an overproduction of this acid because they're going to be very spicy foods, things like that. Also medications. Medications, like we know that aspirin can be good in small doses, but we know that it can create some bleeding of the stomach lining, as well as the NSAIDs, which are the non-steroidal anti-inflammatory drugs like the ibuprofens or the Aleve, things like that, that also can create a disturbance in that lining for some people, not for everybody, but can create that disturbance. And when that happens, bacteria can get out of control, too much acid can be secreted, and those things cause a great deal of issues. Also, there are some structural things in Western medicine. We know with pregnancy, especially because I spent years doing prenatal care for people, basically we know with pregnancy there's a hormone called relaxin, which relaxes everything, and there are little valves in the stomach that hold that stomach acid in place. With the abdomen getting bigger, with the baby getting bigger, and then with that little valve relaxing, it can send that stomach acid up. So that can create heartburn. Now when stomach acid goes up, that can create what's also called GERD, gastroesophageal reflux disease, okay? And that can cause some issues. What we worry about, why do we even care about any of this stuff? Well, what can happen is if that balance is off, if that stomach lining is disturbed, what can happen is you can get ulcerations or bleeding. And when that happens and the acid is in the wrong place or going to the wrong place, you can get little like ulcers. So you can get stomach ulcers, but you can also get in the esophagus, which is the top part. You can also get what's called erosions of that, or what's called Barrett's esophagus. And that can ultimately change the cells underlying, which can create cancer. So we have to be very, very careful about heartburn. So those are some of the issues. It's obviously not an exhaustive list, but that's Western medicine and what causes it. So, oh, also what I should tell you is if that balance is disturbed, all sorts of things can go wrong as far as vitamin balance. There's vitamin B12 that's necessary, and other B vitamins that are necessary, that in balance that can be disrupted. It can also disrupt other chemicals like serotonin. And if serotonin is disrupted, serotonin is like our happy stuff. It's what helps us feel happy, which is why people who are on antidepressants, it's to help them get more serotonin. So this is why it's so important to have that great balance in the stomach. So we've talked about Western medicine reasons. Well, how does alternative medicine look at it? What do they look at with that? Well, in alternative schools of thought, I think it's really interesting that sometimes from a naturopath perspective, that's actually, and even in Total Body Modification, what I do, it's not the hydrochloric acid that they believe is the issue. They believe that what happens is those cells, for all sorts of different reasons, that the wrong cells start secreting, instead of hydrochloric acid, a different type of acid. And what ends up happening with that is that different type of acid creates the problem, not necessarily hydrochloric acid. And then there's things like overgrowth of bacteria, which Western medicine treats as well, and we'll go into that in treatments. But it's their perspective on it is a little bit different. So that goes into treatments. But before we do that, let's even look at acupuncture and herbs and Chinese medicine or Oriental medicine. When I was attending the Pacific College of Oriental Medicine for about a year to learn about it, there was this wonderful, wonderful book that I'll put up right now. And this book was called The Web That Has No Weaver. And it discusses the theories of this medicine. And in those theories, they took a case of heartburn, and they took a case and had 6 different people and 6 different diagnoses in that medicine, which led to 6 different ways of treating it. Because in that medicine, organs have emotions, organs function very differently than in Western medicine. So for example, you can have the liver, it's called attacking the stomach. I know that sounds weird from Western medicine, but basically it's just that chi or that energy moving around that doesn't do what it's supposed to do, and a different organ could actually be the problem. So the way they diagnose in that medicine, you could have 6 different herbal formulas for one case of heartburn. So it's very interesting in the different causes. So now that we know causes, let's go into something very, very important before we cover how do you deal with it. Very important to distinguish between heartburn and heart attack. And I'm going to put up some figures right now about that because it's really important, because men and women, it can feel a little bit different. What's so important to realize is that many people who show up in the emergency room really think they have a bad case of heartburn when they're actually having a heart attack. So if you're ever in doubt, it goes down to 911, get into the ER if you're ever in doubt. Heartburn symptoms tend to resolve when you deal with the issues. If it's a mechanical thing of, like I said, pregnancy and you're sitting up, that can help all the acid go down. If you're taking something for it and it resolves, it's usually not a heart attack. Heart attack doesn't resolve. But that doesn't mean you spend 3 days taking something for it before you go to the hospital. So with those things, you can see the differences. In some cases, for some people, it's pressure in the chest, left arm numbness. For women, sometimes it is a pain that can either radiate to the back, which is very similar to gallbladder pain, or pain that radiates to the jaw, anxiety symptoms, all sorts of different things. So the take home with that is, when in doubt, check it out, okay? So very, very important. So once now we've talked about heart attack stuff, what can we do to try to treat this and help it? Well, it depends on what works for you. In Western medicine, because they believe it's a secretion of too much hydrochloric acid, they're going to do things that block hydrochloric acid or block the histamines if they're out of control. Histamines, like we talked about, everything's in balance, are okay, depending on the balance of it. So they're going to give things that are histamine blockers, and I believe Zantac is one of them. Then there's proton pump inhibitors that they'll put people on, because proton pumps, they secrete out the hydrochloric acid. They're also going to put you on, there's other types of drugs that can help with this, because their way of treating it is to decrease that stomach acid. That's the big difference. And so even Tums, which is interesting because Tums was talking about calcium, which is great, but then there's schools of thought that say, wait a minute, you need to have a certain amount of acid to even absorb that calcium, even if though it can help and it's an antacid. what do we do with that? So that's how Western medicine deals with that. And for many, many, many people, that works really, really well. And then you have to follow your practitioner's advice as to how to do that. So what about chemical reasons? Well, obviously with chemical reasons, it's decreasing things that upset the stomach, like spicy foods, alcohol, cigarettes, those sorts of things that really irritate that stomach lining. So that's the way that that Western medicine looks at it as well. And then from a structural perspective, like I said, if you have, an enlarging abdomen because basically you've got, a baby in there, then you want to make sure to eat smaller meals because bigger meals will go back up. And then also staying upright for a period of time, because a lot of us, we want to eat and go to sleep. And what can happen is everything goes upward for people who have that issue. Now, the other interesting thing, obviously, with alternative schools of thought, in alternative medicine and for many naturopaths, the different way to treat that comes from the belief system that it's not hydrochloric acid that's the big bad guy. It's actually the wrong type coming from the different part of the stomach and different cells. So when that happens, they actually oftentimes will give a supplement of hydrochloric acid. And you think, what are you, nuts? Who would do that? Well, the reason being is if you give that, the theory is, if you give that hydrochloric acid, it will shut off the wrong types of cells from doing that and secreting the bad type of acid that has been converted. And it will stop the stomach acid production because you're giving the stomach acid. And then it can digest your foods and you can get all your B vitamins and things like that. There's also other things that they use, and this can be different supplements. I think it's licorice, but you have to be careful with these supplements. And let me do a little disclaimer about that. I don't even just say, hey, I think this is a good thing to take and go take it. For those of you that know me, you know that I do not advise people to just go get supplements on their own. I'm not an expert at it. I seek out experts. Oftentimes those are the naturopaths that they know, or even in acupuncture and herbs. I'm not going to go just buy a Chinese herb or something like that if I don't know or it's not been prescribed by somebody in that medicine. Because then we don't know, how are they mixing with each other? I mean, it's the same thing with Western medicines. If you're mixing a bunch of medications and your practitioners don't know that, that's a problem. Somebody needs to know everything that you're on. So that's my thing about that. But there are other things that I've heard of, like it's called, naturopaths use slippery elm bark, inner bark of slippery elm. You make like a little gruel or something, and that can actually coat and help those mucus cells and help them secrete. So there's various different ways in addition to using the hydrochloric acid. You have to be careful with stuff like slippery elm because it decreases the effectiveness of the absorption of other medications. So this is why, like I said, please get advice on that. But there are different ways that they look at it. From acupuncture and herbs and those sorts of things, it's different formulas like we talked about that they use. And some of them help coat the stomach and some of them help correct the organ that's actually creating the problem and the problems with the energy flow, and that's what those herbs do. Now, obviously, this is not an exhaustive list of things, but what I want it to do is give you some ideas. So from the medicine that I do, or what's called Total Body Modification, using that applied kinesiology, we deal with it from, first of all, the emotional aspects of it, because this medicine mixes, it's like chiropractic without doing full-on spinal manipulation, and acupuncture theories without using needles and stuff. That structural part, I'm going to put up a picture right now that I want you to look at. And in this picture, you'll see from a structural perspective, what can also cause this problem, and I know you've probably heard of it from Western medicine, is what's called a hiatal hernia. And if you look at this picture, you'll see that there's the diaphragm, which is the muscle that sits below the lungs that expands and opens so that the lungs can fully expand. And we've talked about that in some other videos. And then you'll see sometimes what'll happen, and oftentimes this happens because the rib cage is off. It's called rib torque, and I can show you a little bit here if I can get up here. The rib torque is off, and when that happens, it puts too much pressure on the stomach in one area, not enough on the other, and it sneaks that part of the stomach, the top part of the stomach, up above that diaphragm, and that's called a hiatal hernia. Depending on how bad, and you can see the different pictures, depending on how bad will determine whether it's really, really easy to fix, or there's, in Western medicine, surgical things that can help fix it. But what happens with that is that can go up for just from rib torque, but even if your rib torque is in and okay, which is one thing I do, is gently stretch the rib cage to correct that and align that. But also what you can do is if that stays where it is, and the way I tell people that they can recognize that is when you eat, if you feel your food here right in the middle, that's usually the problem. We should all feel food down here where the stomach is, right? It's down and to the left. That's where we should really feel food. If you don't, that's one of the signs of that. And for many people, they can't eat that much because it's stuck there. So there's a correction to structurally correct that and move that back into the place that it needs to. Now, obviously, it'll keep popping up for a while until the body retrains, because in what I do, it's retraining that. So there's that option too, as well as with the emotions. What I look at in my practice is the emotions of the stomach, which are low self-esteem, but there are other emotions that go with it, and reprogramming that as well. So now I hope you can see there's multiple ways to treat the same thing, and it comes down to what works for you, what you like to do in order to treat that, and what do you want to try, and see what the body wants, and see what the body wants you to do and what fixes it. So I hope this has been helpful. If you like what you've seen, please, if you have any questions, write comments in the comment section. I'll be happy to get back to you. Also, if you like what you've seen, please hit the subscribe button. If you want to continue seeing videos of this type when they come out, you can hit that notification bell. Other than that, I hope that as 2020 heads out, that a lot of heartburn will settle down and a lot of things will brighten up, and that we can go about our lives and feel comfortable and feel safe, and also get rid of that heartburn. Take care now.